Are you over 60 and noticing your legs aren't what they used to be? Does standing up feel like a major effort, requiring you to push off your knees? Do stairs feel like you're lifting weights? Even just crossing the living room can sometimes make you lose your balance. Many people believe this is simply a part of aging. However, the truth is, these are often the earliest signs of age-related muscle loss, also known as sarcopenia. It's a quiet process, occurring without pain or swelling, until one day you find yourself needing assistance just to get out of a chair. But here's the good news: leg strength can be restored, often in a matter of days, with the help of just 3 essential vitamins. No costly therapies, no strenuous exercises, just the right nutrients at the right time. In this video, I'll explain these 3 crucial vitamins every senior needs, how their deficiencies cause weak, heavy legs, and how to combine them safely and effectively for a quick recovery. This isn't health gossip or hearsay. This information is supported by clinical studies, actual research, and decades of professional experience. Stay with me until the very end, and I'll also share a specific vitamin regimen that most people don't follow, but that is incredibly effective. The silent decline. Understanding leg weakness after 60. After the age of 60, your body undergoes a gradual but noticeable change. Your circulation slows, your muscles, particularly in your legs, begin to weaken, and your bones become more brittle. What most people don't realize is that leg weakness is typically the first sign, making even simple tasks like standing up or walking difficult. According to the American Geriatric Society, adults over 60 lose 1 to 3% of their muscle mass annually, even if they're eating normally and feeling fine. This means you might not even be aware that you could be losing up to 15% of your leg strength in just 5 years. So, why does this happen? There are 3 primary causes. 1. Vitamin deficiencies. As we age, our guts absorb nutrients less effectively, and our stomachs produce less acid. This often leads to low levels of vitamin D3, vitamin B12, and vitamin B1. These nutrients are crucial for nerve transmission and muscle contraction. 2. Poor blood circulation. When your circulation slows, your legs receive less oxygen and nutrients. This results in early fatigue, frequent cramping, and that heavy, exhausted feeling in your legs. 3. Less physical activity. Seniors often walk less or avoid stairs, leading to a gradual weakening and shrinking of leg muscles. Without proper movement, muscles struggle to rebuild, even with the correct nutrients. The good news, as I mentioned, is that you can often restore your leg strength in a matter of days by resupplying these 3 deficient vitamins. Let's examine each vitamin in detail and discover how it functions, starting with the one that most elderly people overlook. Vitamin D3, the master switch for leg strength. Vitamin D3 is more than just another vitamin. Did you know that it functions more like a master switch, reactivating your entire nervous, skeletal, and muscular system? Here's the issue. Your body's ability to produce this essential nutrient declines significantly after the age of 60. Your liver and kidneys, crucial for converting vitamin D into its active form, start to slow down. Your skin gets thinner, and you often spend less time in the sun. Consequently, your body begins to shut down vital systems. Your movements slow down, your muscles weaken, your legs feel heavy, and most worrisome of all, your balance starts to deteriorate. All because you are subtly deficient in vitamin D3, a basic nutrient. What makes vitamin D3 so important? Vitamin D3 aids in calcium absorption, which is essential for stable, strong bones. But that's just the start. It also ensures that your muscle fibers contract correctly, facilitates the smooth transmission of signals by your nerves, and above all, prevents the subtle muscle loss that occurs as we age. When you don't get enough D3, your body becomes sluggish, underpowered, and unreliable. How can you determine if you are deficient in vitamin D3? Signs include weakness in your legs, particularly when climbing stairs, exhaustion from standing or walking, leg cramps at night, difficulty balancing when turning or stepping quickly, severe pain in your hips, knees, or heels. Some people may also experience difficulty sleeping at night and mild anxiety or irritability. These mild symptoms are actually early indicators of vitamin D3 deficiency, but they are frequently confused with aging. What is the scientific consensus? Researchers at the University of Birmingham in the United Kingdom looked at people over 65. participants reported an average 19% increase in leg strength after just 5 days of taking 800 international units of vitamin D3. In just a few weeks, seniors who took a D3 supplement and engaged in mild exercise showed a significant improvement in their leg power and balance. According to another Chinese study, researchers at Harvard's Geriatric Research Center found that older adults with low vitamin D3 levels were 40% more likely to fall or be admitted to the hospital than those with normal D3 levels. It's a clear message: vitamin D3 safeguards your independence in addition to your bones. How does it operate? Your body absorbs calcium more efficiently, promotes the development of new muscle fibers, enhances muscle contraction and response time, and lowers latent inflammation in muscle tissue, all of which contribute to more painless and fluid movement. Simply put, vitamin D3 activates your joints and muscles. What is the recommended dosage for healthy adults over 60? Experts advise 800 to 1,000 international units daily. For people who exhibit obvious signs of weakness or who have experienced falls in the past, 1,500 to 2,000 international units per day under medical supervision. For optimal absorption, take vitamin D3 in the morning or early afternoon, and always after a meal that includes healthy fats like salmon, eggs, or olive oil. D3 should never be taken late at night, as it may cause sleep disturbances. Is food sufficient? Regrettably, not without difficulty. Let's examine the figures. Approximately 500 international units are provided by a 100 grams serving of salmon. You only get 40 international units from one egg. There are about 100 international units in a glass of fortified milk. It would be unrealistic for most seniors to consume fatty fish, eggs, and milk every day in order to reach 1,000 international units from food alone. For this reason, taking vitamin D3 supplements is frequently necessary. Who should immediately think about taking supplements? Vitamin D3 should be your top priority if you are over 60, spend little time outside, feel unsteady or have fallen in the past, have osteoporosis or joint pain, or eat a plant-based diet low in dairy and fish. A few crucial warnings: although D3 is usually safe, excessive use over an extended period of time can lead to issues. Long-term use of more than 4,000 international units per day can cause headaches, constipation or nausea, kidney stones from high calcium levels, or irregular heartbeats in sensitive people. This is the crucial element. Take the recommended dosage at the appropriate time and keep a regular check on your levels. Vitamin D3 is the key to helping older adults regain their leg strength. Your muscle systems that have subtly slowed down over time are reactivated by this switch. Vitamin B12, restoring balance, nerve health, and leg confidence. Let's talk about vitamin B12, one of the most important but often overlooked nutrients for people over 60. You may already be aware that vitamin B12 aids in memory and energy, but most people are unaware of this. B12 is essential for the communication between your brain and muscles, particularly your legs. It helps you maintain healthy nerves, coordinated movements, and quick reflexes. When your B12 levels fall, your mind-muscle connection becomes hazy, and the first symptoms usually appear in your lower body. What occurs if your B12 levels are low? You may experience symptoms such as burning, tingling, or numbness in your feet, weakness in your legs, particularly when standing or walking, a feeling that your legs are not listening or are asleep, trouble balancing, even on level ground, and a feeling of unsteadiness or the need for assistance when walking. Additionally, some people suffer from mood swings, mild depression, forgetfulness, and brain fog. Many seniors mistake these symptoms for simply growing older because they frequently appear gradually. However, these symptoms are actually typical of a B12 deficiency. Why is deficiency more common among seniors? There are two primary causes. 1. Inadequate absorption. Our stomachs produce less acid as we age, particularly if you take drugs that lower stomach acid, such as ranitidine or omeprazole. It is more difficult to extract B12 from food in this low-acid environment. 2. A restricted diet. Meat, fish, eggs, and dairy products are nearly the only sources of vitamin B12. You are more vulnerable if you consume less meat or eat a diet high in plants. Your body may not absorb enough, even if you eat a healthy diet. This explains why B12 deficiency is so prevalent in people over 60. What is the scientific consensus? Numerous studies have demonstrated the impact of low B12 on older adults' mobility. Researchers at Oxford University in the United Kingdom tracked over 1,000 seniors who were 65 years of age or older. They discovered that those with low B12 levels walked more slowly, had much worse balance, and were more than twice as likely to fall in the upcoming year as those with normal levels. Clinical trial, Journal of Gerontology. For 8 weeks, seniors in a randomized study received 1,000 micrograms of vitamin B12. Following supplementation, participants reported less numbness and instability, better lower body strength, and faster reaction times. B12 does more than just improve mental acuity. It keeps your body balanced and upright. How your body uses vitamin B12. The production of the protective sheath that surrounds your nerves is aided by vitamin B12. This enables the brain to send precise, quick signals to the muscles. Additionally, it promotes the production of red blood cells, which enhances the delivery of oxygen to muscle tissues and energy metabolism, ensuring that muscles have the fuel they require to function. Your nerves malfunction, your muscles misunderstand orders, and your legs begin to feel unconnected when you are deficient in B12. B12 deficiency is most likely to affect who? You are more likely to be low in B12 if you are over 60, take antacids or acid blockers frequently, eat a vegetarian or low-meat diet, have diabetes and take metformin, have digestive problems like gastritis or irritable bowel syndrome, drink alcohol frequently, or have had gastrointestinal surgery such as weight loss surgery. If this describes you, a quick blood test to measure your B12 levels is worthwhile. Indicators that are frequently overlooked. Some people don't experience the typical tingling or numbness. Rather, they suffer from mild headaches, clumsiness or dropping objects, fatigue that does not go away with rest, and intermittent foot aches or buzzing. Your body is attempting to alert you to these warning signs, and the sooner you address them, the quicker you will recover. What is the recommended dosage of B12? It is safe and effective for adults over 60 to take 500 to 1,000 micrograms of methylcobalamin per day. Methylcobalamin is the active form of B12 that your body can immediately use without converting it. Seniors will particularly benefit from this, as conversion rates decrease with age. It can be taken as a chewable, a spray, or a sublingual tablet that dissolves under your tongue. As coffee and tea can interfere with absorption, it is best to take it in the morning or with lunch. Can food alone provide you with enough? Yes, in principle. In reality, though, it is unlikely. You would have to consume a lot of fish and dairy products or liver every day to meet your needs. The more practical choice for the majority of seniors is a supplement. Is it secure? Because vitamin B12 dissolves in water, your body eliminates excess. Even at high dosages, it is very safe. In healthy adults, there is no known toxic level of B12. However, if you are taking blood thinners or have chronic kidney problems, always consult your doctor. Otherwise, B12 supplements are among the safest and most efficient ways to increase energy, enhance nerve function, and regain control over one's legs for the majority of people. Once their nerve symptoms subside, many older adults report feeling more stable when walking, regaining feeling in their feet, standing up more confidently, and even sleeping better. All because of a nutrient that most people overlook. The benefits of vitamin B12 extend beyond the brain. It's a vitamin for movement. It reestablishes the connection between your body and brain, and your legs feel stronger. Your muscles react more quickly, and your confidence comes back when those lines are clear. Do not disregard any leg weakness, odd sensations, or balance problems you may have been experiencing. Give your nerves what they've been craving by checking your B12. Vitamin B1, the secret ingredient for muscle energy and anti-fatigue. By now, you should understand how vitamin B12 facilitates nerve-to-leg communication and how vitamin D3 builds muscle. However, vitamin B1, sometimes referred to as thiamine, is the final component. If D3 activates the lights and B12 attaches the wires, then vitamin B1 provides the electricity. It's the real force required for your muscles to contract. Your muscles just cannot work without it. Your body runs out of fuel without B1. Even if your bones are strong and your nerves are sharp. Why is vitamin B1 so crucial and what is it? Vitamin B1, also known as thiamine, is essential for energy metabolism. In other words, it aids in the conversion of food, particularly carbohydrates, into adenosine triphosphate, ATP, which is a form of usable energy. Every movement, every breath, every muscle contraction is powered by ATP. Because they are the largest muscles in your body, your legs need a steady supply. When your B1 is low, your muscles feel heavy, fatigue easily, and recover poorly from any movement. Indicators of a possible vitamin B1 deficiency. Many people over 60 report these early symptoms. Even with little activity, legs feel weak or extremely exhausted. Cramping in the muscles, particularly in the feet or calves. A dragging, heavy feeling when moving. Experiencing shortness of breath while ascending stairs. Occasionally feeling lightheaded or exhausted after getting up. A general lack of motivation to move, poor appetite, and mental exhaustion are other possible symptoms. B1 frequently plays a significant role in these classic indicators of a slowing metabolism at the muscular level. What causes seniors to lose their B1 proficiency? There are a number of causes. 1. A reduction in absorption. Our digestive system's ability to absorb thiamine from food declines with age. 2. The use of medications. B1 is eliminated through urine by diuretics, which are frequently used to treat heart problems or high blood pressure. Antibiotics and metformin can also affect B1 levels. 3. Drinking alcohol. Seniors' ability to absorb B1 can be hampered by even modest, regular alcohol consumption, such as wine or beer. 4. A bad diet. B1 is depleted in many processed foods, and your intake may be inadequate if you are consuming fewer whole grains or legumes. What is the conclusion of the research? A 2021 Tokyo University study found that more than 30% of the 300 older adults in the study had low B1 levels. They also walked more slowly, complained of frequent muscle fatigue, and had noticeably less leg strength. Most demonstrated a noticeable increase in energy, walking distance, and stair climbing after taking B1 supplements. A study published in the Journal of Neurological Sciences had patients with persistent leg fatigue receive 100 milligrams of thiamine every day. After 7 days, no side effects were reported. 68% reported less leg pain and heaviness, and 82% reported improved endurance. In what ways does B1 benefit your legs? Vitamin B1 powers the Krebs cycle, your body's primary energy-producing mechanism. This makes it possible for your muscle cells to produce ATP more rapidly, recover from movements more quickly, and keep their strength and tone throughout the day. Additionally, B1 facilitates the transmission of nerve signals, particularly in the peripheral nerves that govern your legs and feet. It's like trying to drive a car without gas. If you don't have B1, nothing moves, but everything functions. What is the required amount of B1? Just 1.2 milligrams per day for men and 1.1 milligrams per day for women is the recommended amount. However, much larger doses are frequently used for therapeutic effect in older adults with symptoms. Doctors often advise seniors who have nerve problems, fatigue, or leg weakness to take 50 to 100 milligrams daily. The good news is that since B1 dissolves in water, any excess can be safely eliminated through urine. The ideal time and method to take it. B1 helps increase energy levels throughout the day, so take it in the morning. It should always be taken with food, preferably one that contains some healthy fat or protein. Avoid taking it with alcohol, coffee, or black tea, as these may hinder absorption. Is B1 derived from food? Yes, but you must be deliberate. Whole grains like brown rice or oats, legumes like beans and lentils, sunflower seeds, and organ and pork meats are excellent providers of B1. The majority of seniors, however, do not consume enough of these foods on a daily basis, and certain diseases or medications prevent absorption. Therefore, a supplement might be a safer option if you are unsure or have recently experienced unusual fatigue. Who ought to think about taking B1 supplements? If even mild activity causes leg fatigue, you should consider a B1 supplement, especially if you take acid-blocking drugs, diuretics, or metformin, have type 2 diabetes, regularly consume alcohol, or have experienced inexplicable appetite loss or weight loss. If so, it would be worthwhile to check your B1 levels or just restore them with a daily dose that is safe. Is it secure? Indeed, thiamine is regarded as one of the safest supplements for senior citizens and has no known toxicity, even at high dosages. However, you should always consult your physician before beginning a high-dose B1 if you are taking medication or have liver or kidney issues. Actual outcomes. Many seniors report feeling more energized, having lighter legs, walking more easily, stairs being less taxing, and a natural desire to be active again after just 3 to 5 days of taking B1. Adding fuel to an engine that has been sputtering for years is analogous to that. The synergistic power. How to combine these 3 vitamins for best results. Now that you are aware of the various ways that vitamins D3, B12, and B1 support your muscles, the next question is, how can you combine them for optimal benefit? Timing and simplicity are key to the solution. Let's start by discussing when to take each vitamin. The best time to take vitamin D3 is in the morning, immediately after breakfast, especially if it includes foods high in healthy fats, such as yogurt, eggs, or a small amount of avocado. Why? Because fat is necessary for the proper absorption of D3, which is fat-soluble. Vitamin B12 is most effective in the early afternoon or around lunchtime. Since B12 also promotes alertness, taking it too late may cause sleep disturbances. Coffee and tea can hinder absorption, so avoid taking them together. Your morning energy source is vitamin B1. Consume it with your first meal of the day, preferably a healthy breakfast that includes whole grains and some protein. It will support your energy levels all day long and even help you focus better. Here's a basic everyday illustration. Breakfast: a single boiled egg, a tiny container of Greek yogurt, 1 vitamin D3 capsule, and a single vitamin B1 tablet. Lunch: tofu or grilled salmon, steamed vegetables, and 1 vitamin B12 tablet or lozenge. Your body receives the ideal combination of nutrients at the ideal time thanks to this arrangement. How about taking a multivitamin? Pay close attention to the label if you are currently taking a multivitamin, because many senior formulas underdose these important nutrients. Make sure it contains the right amounts of D3, B12, and B1. Additionally, note that certain multivitamins combine vitamins that are soluble in water and those that are soluble in fat. Therefore, it is still recommended to take them with food, preferably at lunch or in the morning, and never on an empty stomach. Last piece of advice: it's not always better to have more. Always consult your doctor or pharmacist and take medications as prescribed, particularly if you are managing a chronic illness. When taken as directed, these 3 vitamins function as a well-oiled machine, giving your legs and your life back their strength, balance, and vitality. Safety advice and cautions when taking vitamins. Vitamins are effective means of regaining vitality and health. However, they must be used carefully, just like any other tool. Here are some crucial safety precautions to remember before you head to the pharmacy, particularly if you are over 60. 1. Don't raise the dosage by yourself. It doesn't follow that more is always better just because something is natural. You will not see faster results if you take twice or 3 times the recommended amount. In fact, it could be harmful. For instance, vitamin D3 is fat-soluble. Your calcium levels may rise too high if you take too much over time. Let's say 4,000 international units or more per day without supervision. Kidney stones, constipation, nausea, or even disorientation may result from this. 2. Be cautious if you have kidney or liver issues. These organs are in charge of breaking down and eliminating extra vitamins from your body. Even regular dosages can accumulate and result in adverse effects if they are not functioning properly. Therefore, before beginning new supplements, especially fat-soluble ones like D3, consult your doctor if you have been diagnosed with chronic kidney disease, fatty liver, or any other serious condition. 3. It's simple to overlook certain adverse effects of vitamins. For example, taking large amounts of vitamin B6 for months at a time may result in tingling or numbness in your hands and feet. Though uncommon, it does occur, particularly in cases of unmonitored overuse. Long before more serious issues show up, too much vitamin D3 can cause headaches, cramping in the muscles, or poor appetite. Always keep an eye out for any minor changes in your mood, particularly if they happen after taking a new vitamin. 4. Have your blood levels measured. It is advisable to perform a basic blood test every 6 to 12 months if you are taking D3 or B12 on a long-term basis. This helps ensure that you are not inadvertently taking too much or too little supplementation and that you are in the safe and effective range. In summary, vitamins can undoubtedly enhance your quality of life. However, the secret is to be wise, knowledgeable, and cautious, especially as we age. These 3 basic nutrients have the power to improve your strength, mobility, and independence when taken as directed. Your path to stronger legs. Let's review for a moment. If your legs have been feeling unsteady, heavy, or weak lately, it's not just aging. It's not your imagination, and more significantly, it is not irreversible. We've seen how vitamin D3 helps to build stronger bones and muscles. Vitamin B12 improves your equilibrium and nerves. Additionally, vitamin B1 replenishes your stamina and energy. These three basic vitamins work together to create a potent trio that can help you regain your strength, confidence, and freedom of movement. Here's the secret, though. The first step must be taken by you. Action is always preferable to waiting, whether you're talking to your doctor, taking a morning supplement, or checking your blood levels. I recently had a patient, a gentleman named Arthur, who was 72. He came to me complaining of severe leg weakness. He'd nearly fallen several times just getting out of his favorite armchair, and he'd completely stopped taking his dog for walks, something he used to love. He felt like his legs were made of lead. After running some tests, we found he was significantly deficient in all three vitamins we've discussed today. Within a week of starting him on the recommended regimen, he called me, almost in tears, because he'd walked to his mailbox and back without feeling exhausted. A month later, he was walking his dog around the block again. He told me it felt like he had his old legs back. This isn't just about walking, it's about regaining your independence and enjoying life. So, don't ignore any leg weakness, odd sensations, or balance problems you may have been experiencing. Fuel your legs, and keep going one powerful stride at a time.